Hi everyone, my name is Tanya and today we will be discussing polycystic ovarian syndrome, better known as PCOS. PCOS is one of the most common reproductive disorders in women, affecting an estimated of 1 in 10 in reproductive age. It impacts hormone balance, ovulation, fertility, and even metabolic health. In my presentation, we will cover the normal anatomy and physiology of the female reproductive system, what PCOS is, how it alters normal reproductive function, its symptoms, causes, diagnosis, treatment, and some of the latest research being done today. So let's get started. So to understand PCOS, it helps to first look at the normal reproductive anatomy. The female reproductive system includes the ovaries, which are here, and they're small glands that store mature eggs. Each month, one of these ovaries releases a mature egg during ovulation. The uterus prepares for possible pregnancy while the fallopian tubes, which are these, carry the eggs. Inside each ovary are tiny sacs called follicles. You can see them here, they're little ones. Each follicle holds an immature egg. In a normal cycle, one follicle becomes dominant, matures, and it releases an egg. The ovaries also produce really important hormones like estrogen, progesterone, and small amounts of androgens, which help regulate the menstrual cycle and fertility. The next is normal physiology of menstrual cycle and hormones. So normally the menstrual cycle works because of delicate balances of hormones. The pituitary gland releases FSH and LH, and FSH helps stimulate the follicles to grow. LH triggers ovulation. As the follicles get mature, they produce estrogen, which thickens the uterine lining. And after ovulation, progesterone rises to prepare the uterus for pregnancy. If pregnancy doesn't occur, hormone levels fall and menstruation begins. This cycle depends on ovulation, balanced hormones, normal follicle development, and all things that PCOS disrupts. So, what is PCOS? PCOS is a hormonal disorder in which the ovaries do not function normally. Instead of releasing an egg each month, many follicles stop developing midway. Because ovulation doesn't happen regularly, hormones become unbalanced, especially androgens, which are male type hormones, kind of like testosterone. According to the CDC, PCOS affects about 10 to 12% of women of reproductive age, making it one of the most common causes of infertility. Despite the name of PCOS isn't just about cysts, the cysts are actually immature follicles that never actually release an egg. Let's see how PCOS changes the normal reproductive physiology. So in PCOS, normal reproductive physiology is disrupted in a lot of different ways. First, the follicles begin to grow, but they stop maturing early, so the egg never really fully develops. Because ovulation doesn't happen, the body doesn't produce normal levels of progesterone, which leads to irregular periods. Second, the ovaries produce too many androgens, such as testosterones, and the high androgen levels prevent normal ovulation and cause symptoms like acne, excessive hair growth. And then third, many women with PCOS have insulin resistance, which increases insulin levels. And high insulin, it stimulates the ovaries to make even more androgens, creating a cycle to make the symptoms a little bit even worse than what they already are. On an ultrasound, we usually see enlarged ovary with many small follicles. Sometimes they call them a string of pearls. As you can see, I don't know if you can see my mouse, but you can see here on a normal ovary, there's just a few and they're pretty big. And then on the PCOS ovary, it's a chain of a bunch of immature follicles. So overall, PCOS causes hormone imbalances, lack of ovulation, and altered ovarian function, which affects fertility, menstruation, and our metabolic health. So what are the symptoms of PCOS? PCOS can look different from person to person, but the most common symptom usually include irregular periods or missing your period, difficulty getting pregnant, acne and oily skin, excessive hair growth on your face, on your stomach, or your back, hair thinning on your scalp, weight gain, or difficulty losing weight. And these symptoms happen because of the high androgen levels and the skipped ovulation. So how do they diagnose PCOS? Doctors usually diagnose PCOS with something called the Rotterdam criteria. A woman must have at least 2 of these symptoms, which is irregular or absent ovulation, signs of high androgen levels. They get that with either a blood test or by seeing physical symptoms. Polycystic ovaries on an ultrasound. Blood tests also check for other hormone problems, and doctors often screen for insulin resistance because it's very common for all these things to be together with PCOS. How do you treat or manage PCOS? So right now there's not really a cure for PCOS yet, but there are many ways to manage it. Many treatments plan to manage it. For women that are not trying to get pregnant, birth control helps regulate periods and it helps lower your androgen levels. For women who have insulin resistance, they usually give metformin, and it can improve blood sugar and hormone balance. If you have excessive hair growth, if that's a problem, medications like spironolactone can reduce androgen effects. For the ones that are trying to get pregnant, fertility medications like Clomid or Letrozole help stimulate ovulation. And of course, lifestyle changes, especially exercise and watching what you eat. It's shown to improve symptoms, it regulates your cycle, and it reduces insulin resistance. If you lose even 5 to 10% of weight, it can make a huge difference with PCOS. So with the long-term effects, PCOS doesn't just affect your reproductive system. It can impact long-term health. Women with PCOS are higher risk for infertility because of the lack of ovulation, type 2 diabetes because of the insulin resistance, high cholesterol and heart disease, endometrial hyperplasia. Since periods are irregular, it can cause the uterus lining to build up. It can also cause depression and anxiety. So this is why getting an early diagnosis and being consistent with managing this disease is really important. So let's look at some recent research. So there's some recent studies that are exploring new causes and treatment for PCOS. Some current research suggests that PCOS may be linked to genetic factors, meaning it often runs in families. Scientists are studying the gut microbiome and how gut bacteria can influence hormones and insulin levels. And researchers are also looking at anti-Mullerian hormone, or AMH, because women with PCOS often have a high level of this. And it may play a role on stopping follicles from ovulating. New treatment plans are being developed that target androgen production and insulin pathways. So it gives us hope for more effective therapies later on in the future other than the ones that we just discussed. So to conclude, PCOS is a hormonal condition that disrupts normal ovarian function, ovulation, and menstrual cycle. It can cause symptoms like irregular periods, infertility, acne, metabolic disease, metabolic issues such as insulin resistance. While PCOS can't be cured right now, it can be successfully managed with lifestyle changes and medications. Early treatments can greatly improve fertility outcomes and long-term health. Thank you for listening. And here are my references. Thank you.